Hi, everybody. Welcome to Emerald Bodywork Education. It's an interview moment today. Amy, I am so excited that we are finally going to do an interview to talk about oncology massage. You want to say hi to everybody?
Hi.
So today, hi, I'm Christina Hughes. Not today, every day. I'm Christina Hughes. And the other half of Emerald Bodywork Education is Amy Scottino.
Here I am.
Uh, we're finally going to have an opportunity to talk to Amy about her experience with oncology massage, why oncology massage is important, and why Amy is so passionate about training new therapists in the world of oncology massage. I'm so happy that we're here today and doing this. And Amy, I think I want to start off with what's oncology massage? Can we just start at square one here?
I'd like that actually, yeah, because you and I are a little accustomed to this topic, so it's nothing new for us, and we never want to be desensitized or think that everybody knows the information we know. So I'm going to cite different, more to me, more knowledgeable individuals or organizations. So one organization is Heal Well. They're up north a little bit. They do amazing training and they've been at it longer than I have. And oncology massage, defined by them, is the modification of massage therapy to safely work with the effects of cancer and cancer treatments. So these individuals are currently experiencing cancer treatments or have recently in the past received cancer treatments. And so it's the understanding of how to adjust massage session for that aspect.
Okay. All right. So yes, that's a great definition for oncology massage, but I'm going to speak to those of us that have been in the field for more than about 15 years. And we don't have to tell anybody how long we've been around.
Mm-mm. Nope.
But I know when I was training 20 years ago, first of all, oncology massage was not a thing. It was not on the board. If someone had cancer, we just didn't touch them because you can spread cancer with massage, right?
That's what we thought. You and I both were kind of really shoot away from that because we're like, there wasn't enough information at the time. Now, we know that now. But when I was in school also, it was like, yeah, just don't massage people with cancer. It's just don't do that. And then the rumor was you could spread cancer. In reality, with the amazing research that's out there, and you could go down the rabbit hole like I have on PubMed and read all kinds of scientific findings that it is impossible to have massage spread cancer because cancer will spread when it wants to and how it wants to. There's not just one thing that will cause it to spread, except for cancer itself. Somebody could be taking a shower and cancer decides to spread. They could be having, lunch with their friends and cancer decides to spread. So there's not evidential proof that says massage can spread cancer.
Do you have any statistics or advice for us regarding just cancer and cancer cells within the body in general? The reason why I'm kind of leading you with these questions is, isn't it true that cancer is within the body, malignant cells are within the body at any given time, on any given day, in any given person?
Yes, you will never know if anybody, including yourself, is truly cancer free because we have this thing called an immune system that finds and kills foreign objects, debris, waste, cancer cells, or potential cancer cells. So every day your body is doing its job, your immune system is doing its job. So it's hard to know if somebody is truly cancer free at any moment in their life. Um, does that help? I guess.
Thank you for leading or for following where I was leading you. I
Yeah.
appreciate that.
I'm
These
like,
are
I think that fishing rod's going this way. I'm gonna go this way.
Thank you. I appreciate that. Yeah, I feel like before we even get too far into the topic of oncology massage, period, we just need to nip a few of these things in the bud. And then we can move forward. So yeah, moving
I
forward.
completely, really quick, I completely am respectful of the massage therapists that want to do no harm. They want to be educated and do no harm. So I heard those things and then I was leery because I don't want to do any harm either. So I completely understand where that thought comes from.
Absolutely. Absolutely. And there are therapists that are being trained today, and they're being trained by uh, educators that really operate in the realm of do no harm. And so those conversations are still happening, and that training is still happening because we everyone's being as cautious. And I have a lot of respect for people that are teaching and doing massage, practicing massage within the realm of their understanding. And that's where the research comes into play. That's where the training comes into play. And that's where those that ask questions and begin to challenge, like you've said many times, well, why not? Give me some data, right? That's why we have to be there asking those questions. So this is a little segue here because now I want to know why oncology massage for you. Why are you here? Especially since I know when you trained and I know what we were being taught across the board regarding massage and cancer. So how did you get here? Why do you practice oncology massage?
That's a big question. Let's see if I can sum it up. So we're in Texas. So I also went to school in Texas. So when I went to the fundamental massage program in 2001, there was not a lot of information on cancer and massage. A lot of information about those two separate subjects, but not together. So that was kind of in my head, like we shouldn't massage people living with cancer. And then I was diagnosed with cervical cancer. Massage was the furthest thing from my brain because I had to have a surgery and then I recovered. But then my younger sister was diagnosed with stage 3 skin cancer, melanoma, when she was 5 months pregnant. And I wanted to help her. And so at the time, again, I don't like to travel much. So at the time, I found lymphatic drainage as a way to help her. And they came to Dallas. So that was my first kind of introduction into helping people living with cancer. Now, fast forward, I had helped people in the capacity I knew based on the lymphatic training. And more people were seeking massage while they were going through cancer treatments. I was like, I have to do a wider search. Like, I need to figure out more training because I'm also the one that says, I want to help you. Why can't I help you? I got to find a way to help you. So that's where I came across sweet Gail McDonald's amazing class. And she really put a lot of my fears of doing harm to bay. It was a beautiful, amazing class and amazing learning. And since then, I have merged oncology massage and lymphatic drainage along with some after cancer treatment recoveries, kind of like if you think of like sports and rehab kind of idea and scar work, that kind of has also come into play after people have been done with their cancer treatment. So it's a big crock pot of knowledge that I use, but the meat of it comes from oncology massage training.
Lovely. Lovely. I love for you to share that story. So many of us advance in our careers because we're looking for answers that for those that are closest to us. And that's when you really find the passion. Yeah. Yeah. So another question that I have is what does an oncology class look like? Why do we need special training? If we can touch these people and we're not going to spread cancer, and we really don't know if people are truly cancer free or not, why do we need special training? And what does that even look like? I think I just asked you two questions, but
I hope I can answer two questions. We'll see. Keep me honest if I don't answer both. So, oncology massage training, I feel, is crucial because if somebody is in cancer treatments or 15 years out, there's a lot of knowledge that goes into that massage session, a lot of accommodations and a lot of modifications that will happen sometimes for the life of that client. So it's good. It's really crucial to be educated on all the precautions and long-term side effects of some cancer treatments. I think that was the first question.
Yes, you're doing
Yeah.
great. Hang
Okay.
in. Yeah,
Second one was what a class looks like. Is that what I'm? Oh no, I
sure.
forgot.
Yeah, if we need specific training for oncology, what does that training look like? Obviously, we have an oncology class that we're talking about here. So what does it look like if someone signs up for 24 hours of oncology training? Why do we need 24 hours? And how's it different from any other massage class?
So the reason for the 24 hours is this: if you want to be, I guess, more recognized as an oncology massage therapist, right now, it's good to go to the Society for Oncology Massage website, which is S4OM.org, and you can look for fundamental or beginning training for oncology massage, so that this board has kind of regulated the initial training to kind of be more uniform. So there's certain elements that have to be in this 24-hour program, and therefore they know that everybody's going to have the same information. And it's very recognizable for, let's see, for hospitals, for cancer treatment centers. So if anybody wants to help people in hospitals, this would be a good pathway to go down. And the Society for Oncology Massage has a lot of resources and a lot of information about different classes. I can speak to our class because that's one that we do. It's 3 days, and it kind of goes through, hopefully, the kind of journey that somebody would go through when diagnosed with cancer. So day one is diagnosis with cancer. What does treatment look like? Day two is all the modifications for the side effects. And then hopefully day three is recovery. How do we help them after they are done with the cancer treatment? So that's what our class looks like. And all the elements that Society for Oncology Massage requires are in our class too.
Fantastic. I love it. I'm trying to think if there's anything else we need to cover. Have we forgotten anything?
Hmm. You've hit a lot of the big points, I feel, that are super important.
Yeah, I'm really thankful that you shared your story. What brought you to oncology massage? Super thankful that we busted a few of those myths and paid respect to those that choose to do no harm. But more than anything, I think we we just need to continue to work together as a group of massage therapists, as a profession, to bring awareness. Like you said, it's still out there. There's a lot of information on massage. There's a lot of information on oncology, and we have a lot of work to do to put the research of how these two things can come together and how massage can be a viable part of wellness and recovery for those that are living with cancer. And so I'm really appreciative that you have put this course together. I'm so excited to get to be a part of it. Thank you for that.
You are very welcome.
And I hope everybody will just kind of scroll through our calendar. We have a couple oncology classes coming up that are already scheduled for this year in a couple different locations. So yeah, I really hope that this has piqued some interest.
Yeah, and reach out with any questions if it ever comes up too.
Yeah, absolutely. emeraldbodyworkeducation@gmail.com. So that's our email, or you can reach us through the website. So thanks so much for today. And we hope to have more questions. And we hope to get to see some students real soon. Bye, everybody.